Hi guys, this time Harrison and NEETSS was going together, I think, and it was very tough this time. They had given line by Harrison, so I have taken a selected topics from Harrison which are not given by any coaching centers, and I will make sure that it is from Harrison itself, and you will know this, and you will never have to come back. Just take a book and make sure that you make notes. If you are liking this, I will continue the series and make sure I'll finish it up before NEETSS. I have so many recorded things. If you are supporting me, then I will definitely support you back. So I'll just take only important topics which are needed, right? Okay, let me start. The first topic which I have told is the telomeres. You know about what is telomeres and all those things, right? The telomeres, these are present in the end of the DNAs. These are present in the end of the DNAs and chromosomes, and right, they prevent the degradation of these chromosomes. What you have to remember is that if there is shortening of the telomeres early, it results in aging. If there is no shortening, it results in malignancies. And telomeres, usually you have to take it from the peripheral blood leukocytes, and various methods which are available, which are FISH, quantitative PCR. Remember this. And there is something called as Tesla. So most common affecting are the rapidly dividing organs: bone marrow, lungs, liver, skin. These are affected. Excessive loss of the ends of the chromosomes is called accelerated telomere attrition. This causes aging in the form of the graying of hair. Okay, that's it. And the telomere sequence, most important, is the TTAGGG. What is Hayflick phenomenon? Once the cell divides, telomere shortens, again it divides, again it shortens, and once there is no telomere, the cell dies by apoptosis. Okay, the most important is genes which are available. The genes I will be telling is TERT, TERC. These are most common. Affects whatever telomere diseases I mentioned, everything is there in this. DKC, there is POT associated with malignancy. RTEL, also associated with leukemia. So RTEL, just reverse this and make it LE, leukemia. Remember this, right? I'm just telling whatever is required from Harrison point of view. Okay, so coming to the next page of Harrison. Don't worry about Harrison, because Harrison I have studied in and right and left and out. I know what is important and what is not important in Harrison. Okay. Okay, so diskeratosis congenita, it is a X-linked disease. Okay, it is a X-linked disease. It occurs in less than 20. So first 2 decade, congenita, first 2 decade. It has a triad: ungual dystrophy, reticular skin pigmentation, leukoplakia. Leukoplakia is also having a reticular like thing in the oral cavity. So this is a triad. Please mark it and remember. And also remember, there are 2 syndromes. One is the double H, which I remember it as Hoyarl-Rederson syndrome. This double H, which I address as associated with hypoplasia cerebellum. So remember that 2H associated with H, that is called as cerebellar hypoplasia. And there is one more called as Revesz syndrome. R for Revesz, R for retinopathy. These are associated with diskeratosis congenita. Remember that there is 20% of patients are having pulmonary fibrosis, 10% patients are having liver disease, and the most common mutations is DKC1. Okay, done. Next is the bone marrow failure, which you have to know only one thing. There is aplastic anemia. Patient will not develop immediate aplastic anemia. First he will develop macrocytic anemia, then thrombocytopenia. So which is not affected here is the leukocyte. that is the WBC. There is a preservation initially. Afterwards, leukocyte is also affected, right? Done. Next one is the myeloid. You have to remember it is associated with MDS. Always remember MDS associated with progresses to secondary AML. Next is the pulmonary fibrosis. There is 20% association, as I told, with DKC. Okay, and in that there will be most common type is idiopathic pulmonary fibrosis. Okay, done. So this page is also done. The next page I'm coming up is the one more page. Sorry for the delay. So it has a honeycomb appearance, IPF. You know all these things. It is seen in the 4th decade. Okay, then it is indistinguishable from the IPF which you see in cases of ILD, right? Done. Next one is the liver disease, which I will tell only the important points. It is associated with the steatosis, right? It is associated with hepatic steatosis. Also associated with cirrhosis and hepatocellular carcinoma. Done. This is also done. A minority of individuals are associated with B or alcohol may carry a gene mutations. So this might be a potential question. Remember that there is positive for CD34 and iron deposit and widening of hepatic plates. This is the biopsy. They can ask this. CD34 is a marker for endothelial cells, which is seen in sinusoid. So don't worry, it is a common thing. Next is the long telomere. If the telomeres are preserved, it causes malignancy. In that, most associated is POT1. That's it, done. So telomere length I told already, FISH and qPCR. These are the methods that have been involved. And coming to the genetics part, which I don't want to miss, DKC is associated with X-linked. Dyskeratosis congenita gene associated with X-linked. And autosomal recessive is TERT and TERC, also associated with AD and autosomal recessive. TERT and TERS are associated with autosomal dominant and autosomal recessive. And all these genes I want to know. And sheltering, whether I missed it here, is SPOT1 sequence associated with malignancy. And here there is RTLE1 also associated with leukemia. Done, right? This is what that is asked, can be asked in this table. Coming to the last page of the Harrison's, last second page, whatever I have told is here. I associated with all the retinopathy and all those things, gastrointestinal associated with enterocolitis, skin, central nervous system, hypoplasia of the cerebellum, bone marrow also told, liver also I have told. So this is what you have to know. And one most important technique which I also mentioned is the Stella and the Tesla. Remember, right? I told about the Tesla technique and the Stella technique. Just remember the names. These are also being used. Then the last page is the what you have to do. So you have to do a genetic counseling. Remember that there is something called as liver transplant, also associated with good outcomes. Lung transplant is also being done. Bone marrow transplant is also being done. Avoid toxins, right? And long therapy is also there. Don't need a special mention. You also know there is danazol and nandrolene, which are selective androgen receptor modifiers. Danazol and nandrolene, these are used even in aplastic anemia, can be used here. Thank you guys. Please subscribe to my channel, and remember that if there is a good amount of subscription to my channel, I will definitely provide further videos, and make sure that you will ace the NEETSS this time. Thank you.